Hello, folks. Welcome back to Einstein's Eyes, John and I's YouTube channel. Today, we are going to talk about dry eyes. Actually, John's going to talk about it since his practice is focused on that. What is dry eye? How do you diagnose it? How do you think about it? Assessment and management. And so, John, what do you think about dry eye? How do you take care of a patient that walks in, and how does that factor into what you do?
So just to refresh everyone's memory from the last video you watched, this is Carl. He's in Anchorage. I'm in New Jersey. We both trained together at Albert Einstein, hence Einstein Eyes. Carl specializes in oculoplastics, orbit, real tough stuff. And he's the only certified, correct, oculoplastic specialist in Anchorage. And I'm a corneal specialist, anterior segment. So yeah, as Carl said, this is right up my alley. So today is just going to be a general view of dry eye. We have other videos that are going to be coming out. Some are already there. Some are going to be coming out on various treatments. But suffice it to say, dry eye. So if someone walks in the office, they have symptoms. What symptoms would you think of with dry eye? For me, there's a host of symptoms that I think about when I hear a patient say certain things. So for example, transient visual blurring. Person says, I'm reading a book, all of a sudden it blurs out, clears up as I blink. They might see fogginess that clears up transiently. It comes and then it clears up. They might have irritation, burning, tearing, itching. Those are the classic symptoms of dry eye. So when I hear a patient saying those kind of things, it triggers my diagnosis. I examine them with a microscope looking for signs of dry eye, which we won't go into right here. But I think the most common people that are going to have dry eye, it can happen to anybody. I see 14-year-old boys with dry eye, but it's much more common in women as they age, going from their 30s, 40s, 50s, and later. That can occur with hormonal changes. But women generally have dry eye more than men, but men can have it. Certain medications can trigger it. If you're in a certain environment, like living minus 30 degrees in Anchorage, that's going to trigger dry eye. Windy days are going to trigger dry eye. If you're at a computer all day, if you're driving long periods of distance, your eyes are going to be focusing on the road, and that could trigger dry eye. It doesn't cause it. Using a computer doesn't cause dry eye, but it might exacerbate it. So those are the things I talk to a patient about. They might have started a medication like an antihistamine, an allergy medication recently. That might have triggered their dry eye. They might have started a diuretic for high blood pressure. That might have triggered dry eye. So it's a host of things that we're all thinking about as doctors that might either trigger it or bring it out. But again, the diagnosis, the underlying cause is generally, some people just tend to, with age, develop a problem where they're not producing enough tears, or the tears they're producing are not normal. So those patients that don't have normal tears will have the same symptoms as dry eye because they're lubricating their eye, but it's not really lubricating it adequately. So at that moment, we talk about treatment, which, as I mentioned, we're not going to go into detail other than the first thing I'll do with the patient is tell them, listen, go home, go to the pharmacy, buy a bottle of artificial tears. And that's what they're called, lubricant eye drops. And I'll tell them to put it in frequently, 4, 5, 6 times a day for the first few weeks, just to see if it makes a difference and to confirm my diagnosis. And at that point, we talk again. We say, hey, did that work? Great. If not, if it didn't work at all, maybe I'm wrong, or maybe it worked but not enough. That's when I'm going to discuss all the other treatments.
Right, John. I would also add, and that was very good, but I would add, burning is a cardinal feature of dry eye.
I said it, but I said it fast. I'm a New Yorker. You missed it. Itchy, burning, tearing.
I'm more chill, John. I'm in Anchorage.
Yeah, Anchorage. Itchy, burning, tearing, baby. And but a lot of people don't think of blurred vision. A lot of people don't think of that one.
Right.
It's very common with dry eye.
Right. The surface of the eye, you think of 3 primary layers. You have the mucosal layer, you have the water layer, the aqueous layer, and then you have the lipid layer, which is the oily layer from meibomian glands that prevent evaporation. So primarily think of those 3 layers, and you can dissect out or differentiate those 3 components. And that's what John focuses on and treats. And you can treat specifically for those layers if you diagnose it and you see it with the slit lamp or during your examination. and you can target those pathophysiologies individually if you'd like, with different medications or different processes. But overall, if you have burning, that generally means we think, or you might have dry eye.
Yeah. I didn't mention foreign body sensation. That's actually the most common, which is like a feeling like something's in your eye, like grit or sand. That's extremely common.
Right, right. Real good. So we're going to wrap it up here, folks. We are going to make other videos, and you can see in our playlist also, we talk about various treatments to help treat dry eye.
Yeah, we could just name them. So in case you're watching the video, I mean, there's definitely Restasis, Xiidra, plugs, Lipoflow, Tyrvaya, steroids. Any others that I didn't hit upon?
Well, you could remove some medications that may be precipitated.
The underlying issue.
You could also
Heat,
add
just heating the eyelid. Sometimes people do hot compresses at night. That helps dry eye big time.
Right. And autologous serum. We had Vital Tears.
Right.
We had Raj.
Autologous serum. Vitality.
That can be real help. So can a scleral lens. Sometimes if you trap moisture, you can alleviate all the problems that exist. And there's oculoplastic problems too, like ectropion. There's Bell's palsy, where you can't close your eye properly after a stroke. That can significantly impact the surface of the eye and cause a real problem with burning, vision, and you'll create reflexive tearing. So folks, we're going to get involved with those types of issues later on with other videos. This is an introduction. Thank you for being here. Please like and subscribe. Thank you, Jon. We'll see you on the next one.